I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. A lot of my patients are confused right now about who is eligible for a COVID-19 booster shot and if they should get one. If you are moderately or severely immunocompromised, and that means if you've had an organ transplant or if you're being treated for cancer with chemotherapy or if you're taking medicines that suppress your immune system, then no matter whether you got your initial series with the Pfizer or the Moderna vaccines, you should get a third dose. This is because people who are immunocompromised may not have mounted an adequate immune response to the primary series of vaccines, and a third dose can really increase their protection. You should get the same vaccine you got initially, and you should wait at least 4 weeks after getting your second dose before getting your third. Now, the rest of the recommendations that have been recently released apply only to people who got Pfizer shots initially. We're still waiting on information regarding booster doses for patients who received the Moderna or the Johnson & Johnson shots. These recommendations also apply to people whose second Pfizer dose was at least 6 months ago. But if you're in that category and you are 65 or over, then you should get a third Pfizer dose. If you're 18 years or older and live in a long-term care setting like a nursing home or a skilled nursing facility or an assisted living facility, then you should get a third Pfizer dose. If you are over 50 and have underlying medical conditions that put you at increased risk for severe COVID-19 disease, you should also get a third Pfizer dose. These underlying medical conditions include things like obesity, cancer, chronic kidney or liver disease, chronic lung diseases like COPD or asthma, dementia, diabetes, heart conditions or a history of stroke, pregnancy, sickle cell disease, or if you are a current or past smoker. So these are the categories of people that the CDC says should get that third shot. There are also some additional people who the CDC says may or are allowed to get a third dose if, after an assessment of their individual risks and benefits, they and their doctor feel it is appropriate. So those groups include people between the ages of 18 and 49 with those underlying health conditions we just mentioned, and people who are over 18 who are at increased risk because of their work, such as healthcare workers or frontline essential workers, or because they work or live in an institutional type setting, like a correctional facility or a homeless shelter, where the risk of exposure or transmission may be high. If you still aren't sure which category you fall in or aren't sure if you should get a booster shot, talk to your doctor about your personal risks. These third vaccine doses are important, but the most important message to get out to your community is that people need to get their primary series of shots. Getting the primary series is very effective against severe COVID with hospitalization and death, no matter which group of people you fall into. But if you have questions, ask your doctor. We're here to help. Thank you.